Hello guys, and today we are going to study the Conn syndrome. Conn syndrome is also known as hyperaldosteronism. Hyperaldosteronism. Hyperaldosteronism means we can suggest by the name that there is an excess of aldosterone. So, first of all, we know that there are three layers of the adrenal gland. We had divided adrenal gland to three layers. One is G, you can remember it by G, F and R. Okay, G for glomerulosa, F for fasciculator and R for reticularis. Okay, since we know glomerulosa is the outermost layer and it releases mineralocorticoid like aldosterone. And fasciculator releases glucocorticoid like cortisol. Reticularis are the sex steroids. So since we are studying the Conn syndrome, so we are mainly concerned with the mineralocorticoid or aldosterone. Okay. So as the name suggests, what is the function of the aldosterone normally? Aldosterone main function is sodium conservation, sodium and water conservation. It means that there will be increase, so it will increase the sodium and it will increase the water content in body, whereas simultaneously another function of the aldosterone is to increase the potassium excretion from the body. Now the potassium excretion होता है उसको to increase the potassium excretion. Now, so whenever there will be increased aldosterone, and we know aldosteronism, hyperaldosteronism. What could be the cause of hyperaldosteronism? It could be associated with any tumor, adrenal tumor, or it could be without adrenal tumor. Okay. Whenever it is associated with adrenal tumor, it could be adenoma or carcinoma. Adenoma is the most common one, and because of the adenoma, when hyperaldosteronism occurred, that is, we called it as Conn syndrome. Without adrenal tumor, whenever there will be hyperaldosteronism without tumor in the adrenal gland, it will cause the bilateral cortical hyperplasia. So these are the causes. Now we will study the manifestations. So there will be increased aldosterone in the Conn syndrome, and we had read that its function is to increase the sodium conservation. Is to sodium and water conservation. So whenever there will be increased aldosterone, it will lead to more and more sodium conservation and more water conservation. And simultaneously, we had studied that its another function is to increase the potassium excretion. So it will decrease the potassium in the blood, which means it is increasing the potassium excretion from the body. So increased sodium will lead to hypertension. Decreased potassium will lead to hypokalemia. Okay, and increased water and sodium together will increase the extracellular fluid. Okay, now the symptom that patient will come up to with the symptom of hypertension or hypo because of the hypokalemia or because of the increased ECF. Okay, now since hypokalemia is there, so whenever there is a potassium loss from the body, it would be potassium loss from the body as it would be muscle weakness, fatigability, fatigue होगा patient को, and there will be metabolic alkalosis. And there would be polyuria, polydipsia, and characteristically hypertension mainly would be diastolic, not systolic. Okay, and edema would be absent. So this is the these are the main diagnostic feature of the Conn syndrome. One is diastolic hypertension. Second one is no edema. Third is hypersecretion of aldosterone. And fourth one is low renin. We will study why there is low renin. Okay. Now, see why there is no edema. Whenever there will be low potassium in your body, what happens? The tubules in the kidney, tubules in the kidney becomes resistant to the action of ADH. And what does ADH do? Reabsorption of water. Okay. So when there is a resistance of the action of the ADH, so there will be no reabsorption of water. No reabsorption of water. When there will be no reabsorption of water, it means there will be increased loss of water in the urine. It will lead to polyuria. Okay. Now water had been lost in the urine. In the body, what remains? Only sodium remains. What it will do? It will cause the hypertension. Now, as the water keeps on going out, because of the increased loss of urine, as the water keeps on going out, so there will be no edema. Okay. What we had told, there will be increased aldosterone. Increased aldosterone will lead to increased sodium conservation, increased water conservation, and decreased potassium in the blood. So increased sodium will lead to hypertension, decreased potassium in blood lead to hypokalemia. Hypokalemia will lead to the clinical features like weakness, fatigue, and also metabolic alkalosis. Hypertension would be diastolic more, and then it would be polyuria, polydipsia, edema would be absent. And we had discussed why edema would be absent because of the low potassium. Tubules become resistant to the action of ADH, so there will be no reabsorption of water, which will lead to increased loss of water in urine, so which will lead to polyuria. And as the water keeps on going out, so there will be no edema. Now we will be studying why there is low renin in the blood in Conn syndrome. See, suppose this is juxtaglomerular apparatus. And these are your juxtaglomerular cells. Okay. The main function of these cells detect the blood pressure in the kidney. What these cells do? These juxtaglomerular cells, this detect the any change in blood pressure, any change in BP, in blood pressure. So in aldosteronism में क्या होगा, whenever there will be low BP, so ठीक है, so these extraglomerular cells detect any change in blood pressure. So whenever there will be low BP, they will release the renin. Renin will convert angiotensinogen angiotensin 1 into angiotensin 1. And where all these things happen in lungs. Okay, this angiotensin 1, this will convert into angiotensin 2 by the presence of an enzyme ACE, and this conversion is happening into the lungs. Okay, now this angiotensin 2, what it will do, it will go to the adrenal gland and stimulate the release of, it will go to adrenal gland and stimulate the adrenal gland to release more, to release aldosterone, and so decreased BP will lead to increased renin, will lead to increased aldosterone. This is the sequence whenever there will be low BP. But in Conn syndrome, what is happening? There is increased aldosterone. Already aldosterone is too high. So what will happen? These extraglomerular cells will detect the high BP, and and they will, what they will do, will detect the high BP, and they will inhibit the release of renin, so that no more angiotensinogen will convert into angiotensin 1, no more angiotensin 1 will convert into angiotensin 2, and no more aldosterone will be there in the blood. Okay, that's why to maintain the BP, to maintain the blood pressure, to maintain the sodium and water content in the body, uh, juxtaglomerular cells inhibit the release of renin in the presence of increased BP. So in Conn syndrome, there will be increased aldosterone, there will be increased BP because of the sodium and water conservation, and there will be low renin, and there will be low renin. Okay. So we will summarize what we had done. So we will summarize. In Conn syndrome, the Conn syndrome is hyperaldosteronism. Hyperaldosteronism means there will be increased aldosterone. What is the main function of the aldosterone? Aldosterone is the sodium and water conservation and potassium excretion. It means there will be hypokalemia. Okay, and sodium will be more, so there will be hypertension. So these are the causes we have read, that hyperaldosteronism could be when there will be any tumor in the adrenal gland. When it is associated with adrenal gland, either it could be adenoma or carcinoma. Adenoma is the most common one, and when there is hyperaldosteronism, so because of the adenoma, it is known as Conn syndrome. And without adrenal tumor, it will cause the bilateral cortical hyperplasia. Then we had told whenever there will be increased aldosterone, there will be increased sodium, which will lead to hypertension, characteristically the diastole. And there will be increased extracellular fluid. There will be decreased potassium in blood, because aldosterone will increase the potassium excretion. So hypokalemia will be there, muscle weakness, fatigue, metabolic alkalosis. Polyuria, polydipsia will be there, edema would be absent. There will be low renin. Why edema is absent? Because in the presence of low potassium, tubules become resistant to the action of ATH. So there will be no reabsorption of water by the ATH. So there will be increased loss of water in the urine, which will lead to polyuria. And since there is since water is keeps on going out, there will be no edema. Now these juxtaglomerular cells, these detect any changes in blood pressure. Whenever whenever the BP is going low, they will release the renin. Renin will go into the lungs. Renin will go into the liver and will convert the angiotensinogen into angiotensin 1. When there will be angiotensin 1 will convert into angiotensin 2 by the presence of ACE in the lungs, and then angiotensin 2 will go to the adrenal gland and stimulate it and release the aldosterone. So whenever there will be low BP, there will be increased renin, there will be increased aldosterone. But in the Conn syndrome, there will be increased aldosterone, there will be increased BP, so there will be low renin.